which vessels we have here? First of all, the biggest artery which you see here, it is arteria infraorbitalis, infraorbital artery. Little bit about passage of it, but a lot of times, again, in last lesson, when we speak about buccal region, paracitomas, we describe from deep phase by fissura orbitalis inferior. It is entered inside of the orbit. In the orbit, it is located inside of same name groove, fissura infraorbitalis, which is go to the same name canal. Canal is infraorbitalis. Inside of the canal, it gives two branches to the tooth. Arteria alveolaris superior anterior, arteria alveolaris superior medial, for incisors and for caninas. And then it comes to outside by infraorbital artery and supply the soft tissues in the face region. Again, make anastomose with facial artery as the previous one. That's why it looks so interesting. If for inferior tooths we have only one artery, for superior will be three, two I described. Now third one, it is separate branch of arteria maxillaris, which we call alveolaris superior posterior, for premolars and for molars. That's why your superior tooths will have three arteries, inferior one, only one. Remember, it's not hard. Let's continue. Next branch of last portion, look here please again, very big. We call it sphenopalatine, arteria sphenopalatine. Now look in my door. I told you that place of my door it is fossa pterygopalatina. And you can see that in my door there are the video. And really in the medial wall of fossa pterygopalatina, by the way, it is presented by perpendicular plate of the palatine bone. There are apertures, which are called sphenopalatine aperture. These aperture communicate deep phase with nasal cavity. And through this aperture, the branch of arteria maxillaris is called. By the way, again, not alone. It is passed together with same name nerve, nervus sphenopalatine, which is from nervus maxillaris, and which is made sensory innervation of the mucous membrane of the nasal cavity. Next artery also descending. Look here, please. We call it the greater palatine artery, or descending palatine artery. Both names is used by greater palatine canal. Look. It's come to oral cavity, guys. Yes. It's come to oral cavity. And it's supply the palate softer heart. Mohammed, what is for the heart palate? Which is the roof of your oral cavity? Mohammed, what for? Friend, do you need the translator from Armenian to Chinese? No? I think my English very easy and simple. I say, what is formed the heart palate? If you want, you can try to translate it by Google into from which country you are. Let's translate it in Indian if you want. I don't know. That is anatomy question which you study a lot of times. What is formed your palate? Why are you confused, Mohammed? I'm your teacher. I am responsible to ask you. What is it, Mohammed? What is it, Mohammed? I can come to you. I think you have the problems with vision. Please. What is it, Mohammed? Now you see it. No, please verbally start. It's not necessary to touch it. It's necessary to identify what is it. Friend Mohammed, if you come to my class, it means the previous material is studied and understandable. Because on the base of the previous, now I say you, it is supplied to palate. You don't know what is it. Now what is meaning of my explanation? Just the wind to make the environment is colder. I make the wind here. So if you don't know what is the bones, if you don't know which bones we have, What the meaning that I tell you about much more hard structures. But remember, friend, it forms by two bones. Maybe you will continue. Do you listen, gentlemen, what about this? Please, what about the ask? Heart palate. Please. Which bones forms your heart palate? If it's possible now by tongue, touch the heart palate. Touch my heart palate. They said bones. We have bones. You are from upwards. Now tell me which bones is it? It is even in school, children study, friends, not only in university. Thank you all. You, friend, which bones forms your heart palate? Are you confused me? Great, guys. You're really confused me. I don't understand. What are you doing in my class? Maybe you? Guys, if you don't know, sorry, you generally, one just question. Can I ask you? Can or no? How will you sleep if you have so many problems? How? How will you go to your home and go to the sleep? I just don't understand. Nothing is don't harm your sleeping process. Really? You don't know simple anatomical structures? You study in medical university and you normally sleep in the nights. Yeah? Am I right or no? Fantastic, guys. It's absolutely ununderstandable. Maybe you? Nothing more? Just palatin bone, whole palatin bone, horizontal plate, nothing more? Where is the horizontal plate of your palatin bone? Show it, please. Take your pen and show it. That is, look. Do you see this suture? Only the part of the heart palate which is behind of it, this portion. It is the horizontal plate of your palatin bone. You see the suture. Suture is show that two structures form it. Between them there are border. Only this small posterior part, it is horizontal plate of the palate. What is this huge anterior part? It is palatic process of your maxilla. I don't know even what to say. Anyhow, let's continue. So we understand that our palate, soft palate, and hard palate here, supplied by this artery, which is the palatal descendants artery, which is descending to the arm. Is it understandable for you or no? So once again, sphenopalatine artery, arteria infraorbitalis, arteria palatina descendens, and arteria alveolaris superior, posterior. 4 branches. Let's say 5, let's say 5, and let's say 4. Questions? Hello, are you here? Do you have questions or not? If not, let's continue. Now we come to the nerves which we have inside of the deep face region. First nerve, it is nervus mandibularis. It is third division of which nerve? Why you try to help? It is the same to say there is the nose and don't listen to the answer. This is one of the biggest nerves of the human body. Nervus mandibularis is branch of which nerve? Trigeminal. How many other branches has the trigeminal nerve? if it is trigeminal? How many? Huh? So why are you confused? Let's say first nerve, it is nervus mandibularis. You can see it here. Nervus mandibularis located in interpterygoid space. Why? How you can prove me that it is inside of interpterygoid space? From the knowledge which you know, your anatomical knowledge. Simply because it is come. Huh? Which foramen? Brilliant answer. Just 2 minutes before we inserted inside of spinoso middle meningeal artery. Now in same aperture you inserted also fantastical ability. This is very small aperture there. It cannot contain two different structures. It's impossible. It is passed down through the foramen ovale. Ovale foramen located, as I said before, in mid-side. Mid-side of the face, it is interpterygoid one. For example, foramen rotundum located in the roof of fossa pterygopalatina. Let's say, what is passed by this aperture, by the way? Foramen rotundum. Maybe you? Frank. Hello, I look to you. Why you look to the wall when I look to you? Can you explain? What is passed through the foramen rotundum? Frank, you are also visible, you know, I see you. Maybe you will try to answer my question, what is passed through the foramen rotundum? Or you think that if you will remove your head under the table, teacher will not see you and will not ask you any question. Huh? No, believe me, I see everybody and I can ask everybody. Of course, maxillary branch of the trigeminal nerve. Through the oval aperture, we have mandibular passage. Through the round aperture, we have maxillary passage. So what is happening with this nervus mandibularis? It is finished into 8 terminal branches. From these 8 branches, first 4 branches, it is the motor branches, 2 branches, it is the sensory branches, and 2 branches, it is mixed branches. They have a motor and sensory fibers. Mohammed, tell me please, which branches of mandibular nerve is motor? 100 times in my class I spoke about it. I told you that all masticatory muscles, it is innervated by nervus mandibularis. How many masticatory muscles we have, Mohammed? If you will not answer in this question, I will remove you from my class and will not give you any permission to come again to my lesson. I promise it from you. Now do your best to answer. Or I will go to the rector and will say how the person who didn't know anything from anatomy passed the exam and come to my class. Please. By which muscles you make chewing, Mohammed? Huh? Blah, blah, blah. What it means? Blah, blah, blah. Speak normally, friend. Which masticatory muscles we have? Huh? Number 1.
Temporal.
Nothing more?
Temporal.
I say what I say. If you will not answer, you will go out and will not come to my classes at all. Take that class. Go on. Mohammed, friend, let's understand, not because I am a bad person, because I don't see any meaning of your presence in my class. 100 times in my lessons, I spoke about part of these muscles. We discussed the innervation. We described the supply. We discussed the place of location. So if you're only here to show your physical beauty here, I don't need your physical beauty at all. So take it. I say what I say, Mohammed. Or you answer in my question, or you go out like vice rector of the university, I say it for you. Please, last 1 minute. Friends, am I honest to him or no? Don't look that I am your teacher or something else. Let's understand. I imagine that you work in some restaurant. You try to prepare some beautiful dishes. The persons come and say, what is it? We don't need to even eat. Will you prepare anything else in that kind of environment if nobody didn't want to eat it? Now, he's the person who come in my restaurant and don't need to eat anything from my dishes, don't want to test it, and don't want to know about it. For what he come to me? To show himself or to look in my face? If you need to look in my face, I will give him my photo. Sit down in your home, look in my photo, enjoy your life. For what you come here if you don't want to work? I say what I say, friend, goodbye. Well, you understand me or not? Goodbye, I say. I think it is the most honest attention to you.
Sorry, doctor.
I will sorry, but your knowledge will not be changed, friend. This is not because I have bad attention to you. This is because I don't understand what are you doing in my class. I don't understand why you need me. For what? If you will tell me now my voice is help you to sleep, I will believe you. Because you just sleep in my class, you don't remember what I spoke the previous class. For example, musculus temporalis, which is the huge chewing muscle. Musculus pterygoideus medialis and lateralis, which 2 minutes before I explained you, even I modulated it by my chair and my body. So if all these my explanations, musculus masseter only, you say, okay. But if all my explanations you don't need, friend, for what you're here? Okay, sit down, for me doesn't matter. Anyhow, you will not receive any exam, that is, I promise you. I promise it for you. But now take your next control. Because again I say you, friends, come to the, you are very young. You have a lot of abilities today. Change your profession. If you see that medicine is not for you, friends, it is not a big problem to understand your mistake and to change your profession. For example, will you send your relatives to such kind of the doctor or to your kind of the doctor without knowledge? Will you do it or not? You think that in the future you will have a lot of time to improve your problems? Yes? Today you don't have that time because you work in Armenian government. Let's say from morning up to evening, you are busy. Today you can study. In the future, then you will have family, several children, several children, yeah? Your time will be much more to study my subject, yes? Today you don't have that time, of course. How? If with Mr. Nikol Pashinyan you work in Armenian government, how you can study so secondary problems? In future, you will have more than enough time to improve all these problems, yes or no? In future. In future, you will not have the time to clean your nose. In future, you will have so many problems that it will be impossible to do anything else. If even now, in your most, I can see, free time of the life, you are just a student. You don't have children, you don't have families, you don't have works. If even today you don't have time to study, what about future? Let's say you're a good showman. You come to my class, you make the show that you work, you make show that you need my help. In reality, that is situation which is anyway, plus we come to mono concert. Mono concert. One person stand up, play the violin, another sing it and enjoy the time. Let's say first 4 branches, that is the motor branches, which is directed into 4 masticated muscles. Branch number 5 and number 6, it is 2 sensory branches. First is come to the buccinator, as I say in previous and innervating pubis nervatum, which is covering the surface of it. That's why, as you remember, your buccinator have 2 sources of innervation. One, it is from nervus facialis, which is motor, and second, it is from mandibulosus. Second nerve sensory, you know very well, look at it. As I said before, inside of mandibular canal, we have not only artery, but we have also the nerve with the same name. Nervus angullaris inferior. It is make the sensory innervation of all your inferior tools. Finally, by mental aperture, it come to outside and make the sensory innervation of your chin. That's all. And 2 other branches is mixed. That is your nervus auriculotemporalis and your nervus limbus. Because both these nerves have the vegetative motor fibers. Auriculotemporalis for parotid gland, nervus lingualis for submandibular and sublingual glands. One is come from chorda tympani, second is come from the petrosus minor, which is from glossopharyngeus. That's all. Now we come to the last, deepest structure, which is the nervus maxillaris. This is your nervus maxillaris. Yeah, you can see it is passed by the foramen rotundum. That's why it has the most deep position. And first branch of it, greatly visible, nervus infraorbitalis. Again, when I speak about artery, I told you that it has not alone, but it has with the same name, nervus infraorbitalis. Samely, it is come to the orbit. It is supplied the orbit, then it comes to outside by foramen infraorbitalis. Here is divided into 3 branches. We call it pesa salinus minor. Major one, it is branches of your facial. Minor one, it is branches of your infraorbital. Branches to your nose, branches to your zygomatical region, branches to your upper lip. That's all. Except this one, also nervus sphenopalatina, nervus palatinus descendens, together with the same name arteries. I told you they goes not alone, they goes to the same name nerves. And finally, last one, we tell you before here, it is the branch which is become to the zygomatic region. It's divided into several branches. For example, nervus zygomatico-temporalis, which is come to your temporal region and make the sensory innervation. Zygomatico-facialis, zygomatico-temporalis, zygomatico-orbitalis, 3 branches of the zygomatic. That's it. Friends, it's not hard. Even if the teacher is not explaining you, all the material is given. It is possible to take and to read. Now let's come to the last topic which I want to introduce you. Tell me please which time, how many minutes are there?
It's 45 minutes.
45. It is more than enough. Let's have a look. Let's open the last hour lecture. And let's come to the bone wounds. Yeah, soft tissue wounds. I finished to describe. I told you that first of all we must do rest bleeding. Then we must clean the wound. We must make them use the antiseptics. We must drain. We must refresh the margins. Now let's come to the bones. Bone fractures divided into 4 main types. First one we call the bone cracks or hairline shaped fracture. What does it mean? 1 minute, look to the picture, please. As you can see here, the fracture has the form of a line. And what is important, margins of the fractured bone is not dislocated to each other. You understand? They are located in the same place. What is the treatment? Treatment is only therapeutical. We don't mean surgical. What does it mean? We use the anti-inflammatory medicine if it is necessary, like antibiotics. Analgesics if it is necessary, we can use diuretics to decrease the swellings, yeah, because here will be the swelling. Medicines which is improve the reparation and increase the formation of the bony callus. Let's say you will use the calcium, D3, all these medicines make the increase the regenerative activity of the bony tissue. Yeah? It is increase the activity of which kind of the cells? Which kind of the cells responsible for regeneration of bony tissue?
Osteoblasts.
You see how they help you. You know what will be their help. If in the future they will work in medicine and every week or every month will give you some monies, it will be help. But if instead of you they try to answer, they show that you don't have responsibility to come to your own answer. You understand me? That is not help. Absolutely. And for you, guys, when I speak with somebody, give him chance to answer my question. We are osteoblasts. Let's say treatment is only therapeutical, otherwise conservative treatment, not surgical. Continue with second type of the fractures. It is fractures of external contact layer only. Very seldom cases, and usually it is happened by sharp trauma of the bone. For example, knife trauma. Knife from superficially can perforate your external contact and you stop. That's what we need to do. Only one surgical manipulation, arresting the bleeding from diploidic layer. Last time I told you all the methods how to arrest the bleeding. Let's continue. Third type of the fractures, the most usual. That is the fracture which you can see in this X-ray. It is the fracture of internal contact layer only. Dangerous problem, guys, because from outside it's not visible, it's not identified by ablation, only imaging methods, And fortunately, it can give the hard complications. Of course, it needs the surgical treatment, which we call resectional trephination. What does it mean, resectional trephination? In X-ray, you will see the place of the trauma. According to this place of trauma, you should make trephination and remove external and diploidic layers to open all damaged internal contact layer. Forward. Arresting the bleeding, removing of foreign bodies, cleaning of the wound, washing of the wound, draining of the wound. Everything saved the treatment methods which I described with you. Unfortunately, part of these fragments will be invisible for you inside of the brain tissue. Let's say you will use special equipment. We call it rentgenoscopical. Let's say during the surgery, you will switch it, and on the screen, it will show all the places of the bone. X-rays greatly identify the bone structures because they have high density. So you will use this equipment because partly they will perforate its soft tissues and will not be visible in the surface. Last time of the fractures, as you can see here, it is complete or depressed form of the fractures. What is the specificity of it? All three layers is damaged, and usually they depress inside of the cranial cleft. What is the treatment of it? Two types of treatment. If size of these fragments is 1 centimeter or more, and if they have supplement, it means the periosteum is not destroyed, you put it in its place, and by mechanical constructions you fix it. If it is small microscopical pieces, of course they must be removed, and again we make the resectional type of the trephination. We remove part of the bone. Now you can see, but what with these defects? How they can be closed? Of course, by plastical reconstruction. We'll read my slides. I think find this slide about plastical reconstruction of the skull bones. But unfortunately, in such kind of the cases, it should be closed not immediately, but after some time. For the adults, it is still half of the year. For the children, after 12. Because during the first 6 months, we can have inflammational processes. For example, you don't find some pieces of the bone, abscesses form. You must open, clean, and wash. For the child, size of the head will be increased, and size of aperture also. If you don't have special expanded variants of the materials, which is very seldom, use the external protection before the size of the head will come to the permanent sizes, and only after closing. Let's continue. This is about wounds. And now write please the name of next topic is cartilage.